The National Association of Boards of Pharmacy, which is where we do our licensure, does have a definition of the practice of pharmacy. So this means the practice of a healthcare profession that includes, but is not limited to, interpretation, evaluation, dispensing, and implementation of medical orders, and the initiation and provision of pharmacist care services. I want to highlight that the practice of pharmacy also includes continually optimizing patient safety and quality of services through effective use of emerging technologies and competency-based education. So one thing definitely is that for the practice of pharmacy, it has definitely evolved over time, but optimizing patient care and using the education that we've received to do that is a big part of the pharmacy practice. And just a brief overview of our pharmacy technicians, because they are incredibly important as well. And I'll touch on some more specifics later. But our pharmacy technicians, they also receive a lot of training and education, and they do require licensing and certification. They can become additionally certified in different specialties, but similar to pharmacists, they do require having licensure and maintaining licensure. The responsibilities range depending on the setting. I would say generally, we can encompass that by saying compounding, filling orders, inventory management, doing a lot of processes that assist the pharmacist with the preparation of medications for patients. And this image is kind of an example of outpatient. So like your retail pharmacy, they would be typing up prescriptions, getting labels, calling doctors. So it's a lot of assistance, and pharmacies would not run without pharmacy technicians. So they're definitely very important to the practice of pharmacy. So next, what do your general pharmacists do? So we talked a little bit about what pharmacy is, but behind the scenes, kind of wondering, what do your general pharmacists do? A general role, so this is an overview, is that we review medication orders to determine if they're safe and appropriate for the patient. So an order might come in and we'll look at it and say, does this medication match what the doctor says the patient's taking it for? Is there evidence to support this medication? We'll check the guidelines or the literature and our resources to make sure that the medication is appropriate for the indication. Are there any drug-drug interactions? So we will try to take a look at your medication list, whether you're in the hospital, whether you're at clinic. We might call the pharmacy just to see if we can determine if there's any drug-drug interactions. And if there are, what changes do we have to make, and what can we do with those if we need to contact the doctor or anything like that. What allergies does the patient have? Is the dose correct and in the correct units? Does the dose need to be adjusted for the patient's weight, kidney function, liver function, their vital signs, or if they're having side effects? And then does the medication need to be given with any special instructions? So with or without food, in the morning or at bedtime? Can it be taken at the same time as other medications, etc.? Additional responsibilities include education. So as a pharmacist, there's two different routes. We can either be providing education or we can be receiving education. Providing education would be providing to patients, and that would be our counseling sessions, giving you information on your regimens and supportive care, discussing how the medications work, their side effects. We can provide education to pharmacy students and or residents. So for example, as a mentor or preceptor, we do training, topic discussions, journal clubs, and then additionally, pharmacists can serve as faculty for College of Pharmacies or other colleges as well and do didactic lectures and discussions. In addition to that, we can provide education to our other healthcare professionals. We can do in-services, answer questions, present research. And to the public, we also participate in medical writing and publishing of our research, reviews, chapters, case reports, etc. We then have to continue receiving education. So our continuing education credits usually are by presentations by other pharmacists or healthcare professionals, and they're required to maintain our licensure. And then we also have to be responsible for ourselves and staying up to date on new medications, guidelines changes, process development, clinical trials, and just staying on top of all of the new information that's coming out since we've, graduated from school. So where does your pharmacy team work? So of the various settings and roles for pharmacy, In a generalized setting, we can look at there's community and retail. So that's going to be your, your drugstores or maybe department stores that have a pharmacy included. We have hospitals, so this is inpatient, so when you're admitted, and within this we have decentralized pharmacists, which are pharmacists that are on the floor and doing more patient chart review, and then centralized, which is doing more of the order verification and actual verification of the medications that you'll have in the hospital. There's specialty, outpatient infusion, ambulatory care, and then there's others such as industry, managed care, research. And kind of moving that over into our oncology pharmacy settings, we have hospital inpatient oncology. So if you are in the hospital for any reason or for an oncology reason, there are pharmacists that do deal specifically with supportive care in the hospital, or if you need to get chemotherapy in the hospital, there are pharmacists that will work with that. And then oncology specialty, oncology infusion, ambulatory oncology, and others. So we'll talk a little bit more on some of those as well. For community and retail pharmacy, just a general overview. You may see them when you go to the store and see, the end product is they'll give you the medication, but what they're really doing behind the scenes is reviewing and verifying the orders. Oftentimes we'll get orders that maybe we have a question on, and pharmacists will contact the doctor for clarifications. One thing that I do want to mention is that there is an Illinois law where we have to counsel on new medications. So if you go to the pharmacy to get a new medication, the pharmacist should be talking to you about how to take it. So definitely if you have questions or you're concerned with taking a new medication and how to take it, definitely feel like you can ask them about how to take it, because that's something that that we do as pharmacists. Additionally, we can answer questions, and I want to point out that if it's not even about your medications that you're picking up that day, it can be about over-the-counter medications, and that the pharmacist in the community and retail setting is the most accessible healthcare professional, because you don't have to have an appointment necessarily to reach them. You can go into your pharmacy and ask them a question about, over-the-counter medications or things like that. And here I just have kind of a little image to describe pharmacists and technicians and their responsibilities in the community and retail setting. They share a lot of the same responsibilities in some ways, and then there's more technical responsibilities as well. But it's essentially starting with getting the prescription from the doctor, reviewing it, the pharmacist will review it, the technician will fill it, and then we will dispense it. And in between all those steps, there's, talking to patients, answering phones and things like that. So there's a lot of different characteristics of community and retail pharmacy that your pharmacist will do. Hospital pharmacy, and I did touch a little bit, but we'll review and verify orders very similarly to how outpatient. But now it's inpatient, usually for a more acute reason. There's medication reconciliation. So oftentimes you might have somebody come interview you when you get to the hospital, and this is to verify the medications that you're taking at home and ensure that with those medications and that medication list that we get, that the doctor's ordering the appropriate medications to continue while you were admitted. And then to also review discharge medication lists and counsel on new medications and changes as needed. So when you're discharging, we'll take a look just to make sure that everything that was in the plan for you to resume or to start a discharge that you'll have. And then additionally answering any medication related questions that are needed. And technicians here, they're preparing the medications for pharmacist verification. They're delivering the medications and the stock to the floor. They're compounding. They have to adhere to USP standards, and they're managing a lot of the inventory, minimizing waste, reviewing expirations, and ordering a lot of medications as well. So they have a lot of responsibility to keep the hospital pharmacy running. Specialty pharmacy. So this is essentially for medications that are high cost, or if they're defined as specialty by insurance. So if your insurance is dictating that a medication is specialty, if it's a medication that requires ongoing clinical monitoring, if it has very special or detailed handling, storage, or delivery instructions, or if the medication treats complex or rare disease states. So these medications typically do come from what we call a specialty pharmacy. Pharmacists and technicians both kind of share some responsibilities depending on the specialty pharmacy that you're at. And they can assist with billing and access because, again, these may be high-cost medications. So are we contacting the manufacturer, the insurance, and trying to make sure that we can assist with billing and access as much as possible? Medication therapy management, prior authorization. So if the insurance wants more information on why the patient might be taking a medication, a lot of times pharmacists will help with these to help get the medication covered. And then we also, specialty pharmacies can receive what is called QOPI, or Quality Oncology Practice Initiative certification, which is a 3-year certification that recognizes high quality care for outpatient hematology and oncology practices within the US. And the NM specialty pharmacy is QOPI certified. This is just an image. I won't go through all of the processes here, but just to kind of give you a reference as to how many steps your prescriptions might go through and who kind of has a hand in what. First, you'll get the prescription, and then it'll go through verification with the pharmacist, getting it covered, any other extra steps. So, and then typically specialty may ship them. Basically, from the start to finish, there's a lot of steps that go into it between the pharmacists and the pharmacy technicians, and sometimes other healthcare providers as well. So what do your oncology pharmacists do? So behind every person with cancer is an oncology pharmacy team. So our oncology pharmacy team is made up of an oncology pharmacist and an oncology pharmacy technician. And as an overview, what do we do? Patient education, chemotherapy clinical review, medication preparation, research. So all of these things, and I'll touch on each of them a little bit more as well. But these are all things that the pharmacy team is doing for oncology patients. For our outpatient infusion cancer center pharmacy specifically, our oncology pharmacists are reviewing and verifying those chemotherapies. So if you go to get your chemotherapy IV and you're at the cancer center, there's a pharmacist that's reviewing all of the orders and verifying that based on your labs and everything that the medications are appropriate. And then in addition to that, the technicians are making it. So pharmacists will verify that the medication was correctly prepared by the technician with the correct measurements. There's a double check on our chemotherapy medications just to make sure. So 2 pharmacists review it. And then in addition to that, we have a lot of nurse questions for administration. So there's a lot of answering questions and helping out with that the pharmacist and the outpatient infusion center will do. Technicians, like I mentioned, will do compounding, inventory management, and we're between both people responsible for drug compounding. So both pharmacist and technician have specialized knowledge in drug sterility, stability, preparation, minimizing waste, closed system transfer devices, workflow, and then product supplies and compounding technology. So on the more clinical side, the clinical recommendations, so what a pharmacist is working with or doing on a daily basis. So for chemotherapy selection and dosing factors, we're looking at organ function, so your renal or your kidney or liver's function, how those are doing, and if there's any adjustments that we need to make to the medication. Other conditions that you may have, again, interacting drugs, tolerability, weight. So sometimes if weight fluctuates, we might need to change the dose on a medication. Supportive care and toxicity management. I'll touch on this a little bit in a few minutes as well, but essentially for the side effects and toxicities that we see, there's a lot of supportive care that can be implemented to try to help with those toxicities. And then health maintenance and survivorship. So with a lot of these conditions that you may see alongside cancer, maintaining those, the medications that treat those, and making sure that all of those bases are covered in addition to the chemotherapy. So for chemotherapy preparation, I have some images here. So the first one is just a screenshot of basically a technician preparing medication. So there's a vial there, and you can see we have special protective equipment. So we've got the gown, gloves, a closed system transfer device. There's a lot of protection because we do have, hazardous medications that we are dealing with daily. So there's a lot of different protective equipment and precautions in place. In addition to that, it is a sterile area, so there's a lot of components to making sure that the medication stays sterile prior to administration for the patient. Then you can kind of see what it looks like when the pharmacist is verifying the medication. They're verifying that that drug in the vial was correct, that it's the right strength, that the expiration is okay, that the measured dose is correct, and any other specific details to the medication. And this, for us, is done with a live feed. Some infusion centers and hospitals may have a pharmacist in the IV room, but for us, this is done with a live camera feed. And then you can see that we have the medication prepared and ready for pharmacists to hand over to the nurse. So you can kind of see in the first image what the hood looks like. And then we have our pass-through, which is how the medication gets from the IV room to the pharmacist. And so here I want to touch on implementing oncology pharmacy services within medical oncology. So developing a closed loop model with the integration of clinical pharmacy services within ambulatory oncology clinics. So on the ambulatory side, so the image here, we can kind of see there's a patient and then there's all these people that are working with the patient, and there's a place where the pharmacist fits. And so we can kind of go over how the pharmacist fits in this, in the care for the patient. Board certified oncology pharmacists, typically for being in ambulatory care, this is required. Being a board certified oncology pharmacist, or BCOP as I may call it, they can contribute to patient visits for cancer care treatment, services identified by panelists as provided by BCOPs. So clinical trials, adjusting chemotherapy. So these are all things that pharmacists or board certified pharmacists can do. Assessing chemotherapy response, providing patient counseling and education, medication reconciliation, and a few more that you may or may not have seen or have discussed with a pharmacist. And for ambulatory care oncology pharmacist, for a definition, ambulatory care pharmacy practice is the provision of integrated, accessible healthcare services by pharmacists who are accountable for addressing medication needs, developing sustained partnerships with patients, and practicing in the context of family and community. So it's definitely integrating the pharmacist into the care of the patient. So it's more direct care. This is why you may, in the ambulatory setting, you may see a pharmacist. Our service line here started in 2019, specifically serves malignant hematology patients. And what we do is collaborative management with the provider, so reviewing chemotherapy regimens, assessing the need for supportive care, and evaluating the risk for toxicities. In addition to this, we will be part of patient visits. It could be independent, or we could be seeing patients with the providers. And what we do here is counseling, answering questions, obtaining accurate medication history, giving and providing patient education materials or calendars, and also serving as a liaison between the patient and provider, the pharmacy that the medications are filled at, perhaps the manufacturer if needed, and outside providers as well. So types of supportive care that pharmacy can do with interventions. We have some different things here, and this actually was from a publication that one of the past residents and Pooja, who's my preceptor, worked on. So different types of supportive care can include peripheral neuropathy and management strategies for that, nausea, vomiting, cancer-associated VTE, so that would be blood clots, managing medications for those. And then on a bigger scale, or more common things that we may see are going to be maybe GI upset, so diarrhea, constipation, mucositis, heartburn. And there's a lot of pharmacy interventions that can happen here with different recommendations on different medications to try, what dose to do. And then there are other, such as an anti-infective or immunization, that the pharmacist will look through a lot of these things and make sure that all of the bases are covered for what's recommended for each patient based on, their individual factors. the treatment or the condition that we are treating, and then the treatment that they're receiving for the condition. And so this is an example of patient education. So this is actually, it's a calendar. And so oftentimes, depending on what treatment a patient is getting, there are different calendars or different pieces of education that we can give the patient to take home that might be helpful. So this one specifically kind of specifies what days you might be doing what medication. That way, for the patient, it may be easier to know what to do on what day and what to expect for like the next week or the next couple weeks. This is another example of patient education. So for example, mucositis, there's education for what can put you at risk. And this goes for all different kinds of toxicities or side effects that you may see. But pharmacists can gather these pieces of information and give you the important parts of it, but also give you the information to take home so that you have it to review as well. So the oncology pharmacist, as part of collaboration with like the community pharmacy, this is more in that if there's a medication that's recommended or if the doctor wants to start something, we can help with facilitating that and talking basically with the pharmacy. So you'll have two pharmacists kind of working on the same issue, just on two different sides, but sometimes they'll work together in order to make sure that the medication is ordered correctly and that the patient gets the medication. On the specialty side, oftentimes there may be a little bit more involvement depending on how much restriction there is for getting a medication. But just knowing that the oncology team has a pharmacist and that the specialty pharmacy with their pharmacist, both of them working together, helps to make sure that the patient gets the medication in a timely manner. And additional roles and opportunities for oncology pharmacists are investigational drug services, so clinical trials. So a lot of chemotherapy regimens may be actually within a clinical trial, so reviewing the protocol, reviewing the medication and any specifics for how the medication needs to be received, any documentation that needs to be done. In addition to this, we also have organization involvement. So pharmacists, and this is a broad thing for pharmacists, but specifically looking at oncology pharmacists, can be members or leaders in organizations and have committee involvement, can present for different organizations or publish. So some of the more common ones might be NCCN or National Comprehensive Cancer Network, which is our basic guideline for a lot of cancers. HOPA, Hematology Oncology Pharmacy Association, and then a few more, so ASCO, NCODA, ONS, and some other ones as well, where we may be involved with those organizations. So now we've reviewed kind of a lot of the oncology setting, but where are other settings for pharmacists that you may encounter? We have industry, so this would be drug development or research, or oftentimes there may be a medical science liaison that is a pharmacist. And so this is if, for example, you had a question and you called the manufacturer. Oftentimes you may reach a medical science liaison or a pharmacist to help give you the answer to that question. Then there's managed care, which is where basically pharmacists work to improve patient and population health outcomes and optimize the use of healthcare resources. So it covers between the patient, the provider, healthcare plans, and making sure that all of those are working for patient population optimization of all of these resources. There's informatics, which is very important to oncology side as well, which is dealing more with the electronic health record, so the builds, maintenance, and support. So a lot of these regimens will be kind of built into the electronic health record. So it helps a lot with safety because there's a lot of standardized things that will go into this with the electronic health record, and there's pharmacists that work on this. In addition to that, there's interoperability. So for example, if you're in the infusion center and you're getting your medication, there's EHR communication with the infusion pumps, and there are pharmacists that will work with this as well. So basically ensuring that the system that we use for ordering and verifying medications is communicating with the pump that's giving the medication. And then data analysts are another version for informatics for what pharmacists can do. So I've covered a lot of different aspects of pharmacy. So I just have a few take-home points that I wanted to discuss. And that's that pharmacy is made up of pharmacists and pharmacy technicians. So if you refer to pharmacy or the doctor refers to pharmacy, just know that it's both pharmacists and pharmacy technicians. In addition to that, whether you are at the hospital, the clinic, the local pharmacy, or at home, you have multiple pharmacists on your healthcare team that utilize their training, education, and support from the pharmacy technicians to provide patient care. So there are definitely pharmacists on your team that are utilizing those things to ensure the safety and appropriateness of your therapy. And lastly, pharmacy has a lot to offer you. So if you don't see a pharmacist often, you are definitely welcome to ask to speak with a pharmacist if you have any questions related to medications. We are always very happy to help with that and to provide any kind of information or help that we might need to, whether it's just a medication that you're receiving in clinic, whether it's all of your medications, just know that you can ask to speak with a pharmacist on your medications, and that will help you the best we can.